Thank you for inviting me, and I want to thank the organizers, especially Denmark, UNFPA, and the UN Secretariat for making this possible, and thank you for being part of this. Us too, of course. As health is one of the SDGs under review at the upcoming high-level political forum in July this year, I think this particular conference is very, very timely. Yes, as you correctly said, India has the largest youth population in the world, with almost 2/3 of the population under 35 years of age. This makes intergenerational dialogue even more important, and this will drive the agenda of healthy lives and propel economic development going forward. Allow me to focus on a few critical issues. I think as far as the younger population is concerned, maternal and child health, malnutrition, and access to quality health care continue to be areas of focus for India. As far as the old age population is concerned, health issues and diseases related to old age, access to affordable health care service, lack of health coverage are some of the other issues. There's a growing prevalence of age and lifestyle related non-communicable diseases, which is significant. I would like to focus on 5 points for purposes of today's discussion. First, how did India tackle some of the intergenerational issues that you mentioned? First is an increased investment in health. In the latest budget allocation for this year, we have seen a nearly 10% increase in health budget allocation in India. Access to affordable health care is fundamental to a higher standard of life. Our national program called the Ayushman Bharat scheme, which is a kind of a health insurance scheme. It covers around 550 million people with a health cover of nearly $6,000 per family per year for secondary and tertiary care. Our policies have resulted in a reduction in out-of-pocket expenditure by almost a third. Focusing on the older population, the government of India has expanded this to all senior citizens aged 70 and above, benefiting 45 million families, including 60 million senior citizens. Second, I think our approach to health and healthcare services has been focused on undertaking a community-based approach. We have ASHA workers, the largest community health collective globally, who have led towards a significant reduction in maternal mortality and significantly addressed the whole issue of malnutrition through the Integrated Child Development Scheme to combat malnutrition and strengthen early childhood care. I think the midday meal scheme is another initiative that has helped tackle the twin issues of malnutrition and early childhood education. Thirdly, I think a lot of young people face stress, alienation, and mental health issues. We have just heard from previous speakers, the reference to adolescents. I think this is the result of both work and technology overload. For older adults, of course, they struggle with isolation due to changing family structures and due to migration. I think in 2014, the General Assembly established the International Day of Yoga, recognizing yoga's role in promoting health, preventing diseases, and treating lifestyle disorders. Yoga is deeply integrated into Indian life, with meditation being a powerful tool for well-being. We are happy the General Assembly last year declared 21st December as a World Meditation Day, recognizing the positive impact of meditation on our overall well-being. I think our own civilizational heritage offers benefits of meditation for overall social wellness. Fourthly, we have very dynamic systems of traditional medicine in India that include Ayurveda, Siddha, Unani, and these have complemented modern healthcare and passed through generations, strengthening intergenerational bonds. The WHO's global recognition of traditional medicine, including the establishment of a WHO Center for Traditional Medicine in Jamnagar, highlights its growing importance in the overall healthcare delivery. Finally, I think leveraging technology is very important, and we have been successful in leveraging digital public infrastructure for affordable healthcare to all. The Ayushman Bharat digital mission aims to develop the digital backbone that's necessary to support integrated digital health infrastructure in the country. We have developed a unique health ID, a comprehensive database of healthcare professionals, healthcare facilities, and a unified health interface to ensure seamless delivery of government assistance in the healthcare sector. Before I end, I want to refer to one point, and I want to thank Dr. Singh for bringing it about. I was a very young diplomat in Cairo in 1994 when ICPD was held. You correctly raised the issue of the right to development. Let us all remember that the ICPD was a framework which had a delicate balance of responsibilities and rights across generations and age groups. Yet, today we pick and choose some of the principles that were enumerated in the ICPD. We highlight some and we ignore others. As a point raised by Dr. Sen, Principle 3, right to development is a universal and inalienable right and an integrated part of fundamental human rights. So says the document. Principle 7, of course, seeks international cooperation for eradicating poverty. Principle 9 focuses that family is the basic unit of society and as such should be strengthened. It says that the family is entitled to receive comprehensive protection and support. Principle 12 focuses on migrants' rights. Principle 13 on asylum rights. Principle 14 on the rights of indigenous peoples. And Principle 15 on that growth should be broad-based for it to be sustainable, and that developed countries acknowledge the responsibility that they bear in the international pursuit of sustainable development. If we were to pick and choose the various framework, the rights in the framework of population and development, I think it would be very difficult to achieve the outcomes that we all seek to achieve. Intergenerationally within the society, of course, we must address the imbalances, but the larger imbalances in the world around us in terms of development, in terms of addressing issues of poverty, and addressing means by which you can strengthen the unit of family for there to be greater sustainability in the pathway that we seek to forge ahead is also very important. Thank you.